I know when we talked last, you guys were around 20 clinicians and 40 guides, which my sense is that's pretty significant scale, especially the number of patients you can treat with that. But how does scaling work? And I guess some of the questions I wanted to ask there, and these may be completely dumb questions, but that's part of my job, is
No such thing.
so things like, are there regulatory issues in terms of rolling this out? Is any of this still state by state, different regulatory environments and kind of legal environments? Like, just talk a little bit about what the journey has been like scaling, what it's like scaling a telemedicine practice, and any of the kind of weird mechanics around legal regulatory issues people might not know.
I could talk for the rest of this podcast and several more about the regulatory considerations of expanding a telemedicine practice. I'll spare your
They're
listeners.
considerable, I guess.
But yeah, there are states, each state has their own regulations around telemedicine prescribing, scope of practice for providers. So these are all things that we have to navigate. And fortunately, we're not the first who's had to navigate it. So we are able to learn from other companies who have like paved the way. And of course, we spend lavishly on telemedicine attorneys and have a great general counsel to help us navigate this as well. So a lot of that. Once you kind of tackle that, the scaling is, I think what's really been exciting and perhaps surprising to us is how much our clinicians love this work, because I think it's a dirty secret in psychiatry that things don't work very well. Like the traditional medications don't work very well. And with antidepressants, it's 40-40. There's 40% chance that an antidepressant is going to work and 40% chance that you're going to have side effects.
Terrible.
And it takes 4 to 6 weeks to figure out if an antidepressant is working. So as a clinician, like it can be a slog to work with someone over a long period of time and tweak medication to find something that works. And when it does, it's amazing. And our clinicians like love working in mental health for that reason. They're able to see real progress in their clients over time. And Mindbloom, our clinicians and our guides are seeing progress at the end of the first session at times. For some people, it might take a few sessions to start to see benefit, but still you're working on a timeline of days or weeks as opposed to months. And the percentage of our clients who are having positive experiences and clinical benefit, as we talked before, is 88% of our clients see improvement in depression. And like our NPS is 70, which is crazy high for healthcare. So our clients are also having really great experiences. And so that creates a really great, positive environment for our guides and clinicians. So scaling telemedicine is kind of, as you referenced before, great because you don't need a physical practice. So what we can do is hire clinicians, hook them up to our platform once they're trained in our protocols and in our tools. And that opens up their schedule for clients to schedule with them. So we can really rapidly add coaches and clinicians to our platform. And then, of course, we navigate the state-by-state regulatory environments as we go, but it does make it possible to scale very quickly. And so we're, of course, priority number one is safety. So scaling at a rate that we can maintain quality and safety for our clients. But even since we last spoke, we're now up to 30 clinicians and 50 guides. So it's now that we've proven that the model works and we can scale it safely while maintaining these incredible client outcomes, we want to help as many people as we can and get this to people across the country. We're in 12 states and serving 50% of the population right now. And we expect to be available to 75% of the population by the end of the year.